Hi friends, today we'll deal with 5 questions from the endocrine system. The first question is, a client with type 1 diabetes mellitus has diabetes ketoacidosis. Which finding has greatest effect on fluid loss? The options are: the correct answer for this question is option 3, rapid and deep respiration. Due to rapid and deep respiration, there is fluid loss from the lungs through vaporization and from the skin through insensible loss. The other options like decreased serum potassium has no effect on insensible fluid loss. Hypotension occurs due to polyuria and inadequate fluid intake. Now the next question. The nurse teaches the client to report signs and symptoms of which potential complications after hypophysectomy? The options are: the correct answer for this question is option 2, hypopituitarism. It's important to know what hypophysectomy is. Hypophysectomy is a surgical removal of hypophysis. Hypophysis is nothing but pituitary gland itself. So as you all know, there will be a decrease in all the hormones produced by the pituitary gland. Now the next question. Diabetes mellitus affects metabolism of which nutrients? The options are: the correct answer is option 3, proteins, fats and carbohydrates. Sometimes we come across some clients with diabetes mellitus who just say that if I avoid all the carbohydrates in my diet, I would be okay. But the nurse should be able to explain to the client that appropriate amount of protein, fat, carbohydrate, minerals and vitamins should be included in the client's diet. Moving on to the next question. A 62-year-old female diagnosed with hypothyroidism. What should a nurse assess client for? These are the options. The correct answer is option 3, weight gain. As you can see here, these are the signs and symptoms of hypothyroidism. The other two options like diarrhea and nausea are not symptoms of hypothyroidism. Tachycardia is a sign of hyperthyroidism. Now moving on to the next question. To reduce risk of type 2 diabetes mellitus, advise client to. The options are: the correct answer is maintain weight in normal limits, option 1. Obesity is a predisposing factor to develop type 2 diabetes mellitus. Insulin resistance also increases with obesity. The other options like cigarette smoking and hypertension, they are not predisposing factors, but they are risk factors to increase complications of diabetes mellitus. High cholesterol will contribute to obesity. Thank you for watching the video. If you find it informative and useful, do share it with your friends. Thanks.